Sleep is a very important topic for concussion. Oftentimes, when I have a concussion patient, I will look at all of their symptoms as a whole and try to figure out, what is the one thing that if I could fix this one thing, it'll have a cascade effect to fix other things. And so, the way that I talk about this frequently, excuse me, is what is the thread that I can pull on that will unravel the entire, sweater that is post-concussion syndrome. And the way that sleep interacts with so many other processes, sleep is often the one thread that you can pull on. If you're not sleeping well, you're going to have the symptom of fatigue. You're also going to probably feel a little bit foggy. You're also going to have concentration difficulties and cognitive problems. Sleep deprivation on its own, with irrespective of concussion, irrespective of brain injury, if you take people and just deprive them of sleep and then administer cognitive tests, they will have cognitive impairment, similar to a concussion patient. So when you have a concussion patient who's not sleeping and they're also reporting, fatigue, fogginess, troubles concentrating, difficulty remembering, all these other things, is that because of concussion or is that because they're not sleeping properly? Chicken or the egg? So if I can control sleep and if I can get this person sleeping better, I can often get rid of the fatigue and all the other symptoms that go along with it. So that's what I mean by that. What's the one thread I can pull on that it's going to unravel a whole bunch of other things? Anxiety. If you throw anxiety in there, anxiety by itself can cause a lot of the same symptoms as concussion. And it can also create sleep disruption. Or sleep disruption can also create increased anxiety. So you have a chicken or the egg scenario. So if somebody has anxiety and sleep disturbances, you want to start tackling both of those things kind of simultaneously, because going after one, you might be missing the other and you're not going to be able to have a good outcome. So sleep is often the thread that I want to pull on. As I said, by itself, if you didn't even have a concussion, but if you have sleep disruption, you're going to have cognitive impairments, you're going to have headaches, you're going to have all of the other symptoms that might go along with concussion. And I think in concussion, because the overlap, because the symptoms are nonspecific, you end up with a whole host of other problems that you're trying to figure out which one is actually driving the symptoms. And that's really the difficult thing with PCS cases. So sleep is also extremely important and critical for healing following brain injury or injury in general. It helps to flush out neurotoxins. It helps to restore damaged DNA in neurons, helps to increase the production of oligodendrocyte precursors, which are needed for the production of myelin, which helps with signal transmission of the brain, also helps with protection and buffering of the brain and keeping things within the neuron. So it helps contribute to the sheath around the neuron, and it does a number of other important things. So sleep is vitally important to regeneration, repair, and neuroplasticity, if you will. According to a study by Howell in 2019, 45% of adolescents report having sleep difficulties in the first 10 days after concussion. And no surprise, this was also correlated with having worse symptoms, having an increased symptom burden. When you start looking at chronic patients in the PCS stages, these numbers climb even more. Brooks and colleagues in 2019 found that 62% of adolescents who were an average of 6 months after injury had clinically significant insomnia. This was associated with higher concussion symptoms, higher anxiety, and higher depression. So now again, chicken or the egg. Are they depressed and anxious because they're not sleeping? Or are they not sleeping because they're depressed and anxious? So again, like I said, when it comes to these types of things, you have to make sure you're addressing both things simultaneously. The most common sleep complaints in adults with persistent concussion symptoms are excessive daytime sleepiness, which is reported in about 50% of cases. So for those of you out there listening that have concussion patients reporting excessive daytime sleepiness, or for those of you that are concussion patients, you can probably attest to the fact that you have increased daytime sleepiness. And that's 50% of cases. 33% of cases report insomnia at night, not being able to sleep. Half of those report that their insomnia is trouble falling asleep, and then the other half report that it's trouble staying asleep or frequent waking. So this can hit from a number of different ways and a number of different things. So there are a number of reasons why sleep can be affected following concussion. One, there is evidence of reduced melatonin production. Melatonin is the sleep hormone. It is released by the pineal gland in full darkness. So light stimulation, when light hits your retina, it suppresses melatonin production, which then prevents you from sleeping because you need melatonin production to have sleep onset. And we're going to talk more about that coming up. Number two, there's also some evidence that the neurometabolic cascade of concussion, what it does in terms of all that neuronal firing after injury and the release of glutamate, that can affect the circadian rhythm following concussion. So your circadian rhythm, is your sleep-wake cycle. So you're awake in the day, you're asleep at night. That is your normal circadian rhythm. The concussion injury, the stuff that happens at the time of injury, has been shown or is thought at least to affect the circadian rhythm. And number three, other hormone imbalances. So melatonin is probably the most well-known hormone associated with sleep, but there's also other hormones that are involved in sleep and wakefulness, and recent evidence demonstrates that there's a tremendous amount of hormonal imbalances in patients following concussion. As many as 30% of patients 6 months or more after injury have been shown to have different imbalances in hormones, and some of these hormones are involved in sleep and wakefulness. So to understand how this works and why, what I'm going to talk about in terms of blue light stimulation, how sleep actually works. And this is going to be by no means an exhaustive explanation of how sleep works because it's an extremely complex process. But in a nutshell, throughout your day, you get a buildup of substances. And that creates kind of this sleep debt, which makes you fatigued. One of those substances is adenosine, which is a byproduct of energy use. So ATP, adenosine triphosphate, is the energy molecule that we use for our bodily processes. Over the course of a day, as you're burning energy and doing stuff, you have an increase in buildup of adenosine. You also have an increased buildup of cytokines, which is your immune cells. And this buildup is what makes you feel sleepy. This is often why when you're fighting a cold or infection, you do feel the urge to sleep more because of the increased inflammatory and immune response, which also is present following concussion. As these build up, you get more fatigued. If you get a certain amount of good deep sleep, so your non-REM sleep, in your deep sleep, your slow wave sleep, if you get a good amount of that in the night, you actually restore those adenosine levels and reduce those inflammatory mediators for the next morning, which then allows you to have no sleep debt and you're awake and alert the next day. So that's kind of that rhythm, is you have this buildup of stuff over the day, you restore it overnight, and then you build up again over the day, and you have kind of this ongoing fluctuation.